If you're comparing Medicare Advantage and Medicare Supplement plans, there's something very important that you need to understand first. These two options are not solving the same problem in the same way. They're often presented side by side as if they're equals, but they're not equals, either in benefits provided or in how they're structured. When people don't understand that difference, they make decisions that can cost them real money and real access to care later on. In this video, I'm going to explain what each option actually does, what problem each one is designed to solve, and how to think about this decision correctly, especially long-term. Hi, my name is Matthew Claassen with MedigapSeminars.org. We focus on Medicare education, no sales pressure. Our goal is to help you make an informed decision and help you with your Medicare decisions when you're ready. What you're about to hear is the explanation that most people wish they had before choosing a plan. To understand this comparison, we have to start with Original Medicare. Everyone who enrolls in Medicare starts here. Original Medicare has two parts. It's Medicare Part A is your inpatient care insurance, like hospital stays. Medicare Part B covers outpatient care, like doctor visits, tests, and procedures. So this is the red, white, and blue card, the Medicare card. Original Medicare is administered by the federal government. The doctors and hospitals typically bill Medicare directly, and Medicare pays its share of your bill. But Original Medicare has no annual maximum out-of-pocket limit. That means there's no built-in ceiling on how much you may be financially liable for in a worst-case scenario or even just a bad health year. So here's the real issue people are trying to address. It's not just the gaps, it's the financial exposure. People want a practical limit on how much they could be required to pay if they get sick, if they need surgery, or face long-term treatment. Medicare Supplement plans and Medicare Advantage plans both address this concern, but they do it in a very different way. And those differences can lead to very different outcomes. A Medicare Supplement plan works with Original Medicare by increasing the financial benefits paid on your behalf. Original Medicare remains your primary insurance. Medicare pays first, then the supplement then helps cover some or all of the costs that Medicare leaves behind, the things like the deductibles and the co-insurance. The important point is that Medicare decides what's covered. The supplement does not replace Medicare. It does not manage your care, and it does not impose its own rules. A Medicare supplement is required to pay the benefits exactly as directed by Medicare, and Medicare's intent is to cover everything medically necessary to diagnose and treat any injury, any disease or condition. Because of that structure, there are no provider networks. You can see any medical provider who accepts Medicare anywhere in the United States or U.S. territories. There are no referrals required. Your healthcare decisions are entirely between you and your doctor. And there are no prior authorizations imposed by the supplement to limit your health care. Your maximum financial exposure is limited by the supplement design itself, rather than by a cap that only applies after you've already paid substantial cost sharing. Medicare Advantage plans work very differently. When you enroll in a Medicare Advantage plan, Original Medicare is replaced. The Advantage plan is your primary coverage. You must still pay your Medicare Part B premium and any IRMA surcharges, but Medicare no longer has a say in your insurance coverage. Medicare still funds the Advantage plan, but a for-profit non-government insurance company administers your care. These companies are almost always publicly traded corporations beholding to their shareholders, not you. They are regulated, but they are not standardized. The way Medicare Advantage plans limit financial exposures is by creating a maximum out-of-pocket limit, and that limit can adjust higher each year. But it's important to understand that what happens before you reach that maximum out-of-pocket limit Many Medicare Advantage plans include hospital cost sharing that is similar in size to the Medicare Part A deductible. And keep in mind the Part A deductible is a per event deductible. It can apply multiple times per year depending on how your care is structured. Most Medicare Advantage plans use co-pays for routine care or primary care visits or specialist visits and outpatient services, and those costs continue to add up over time. Now, for cancer treatment, an all too common health threat, Medicare Advantage plans typically cover only 80%, leaving you responsible for the remaining 20% until you reach the plan's maximum out-of-pocket limit for that year. That limit does provide protection, but only after significant cost sharing has occurred. So Medicare Advantage plans are regulated, but they are not standardized. And there are more than 3,000 different Medicare Advantage plans across the country, each with its own deductibles, co-pays, networks, and rules. Every feature of every Advantage plan can change each calendar year. Each plan sets its own requirements within the broad federal guidelines established by Medicare. Now, in practice, plans often push those boundaries. And then the regulators step in and the rules are adjusted or the insurance company is fined. But by the time that happens, the impact has already been felt by real people making real healthcare decisions in moments where delays or denials cannot simply be undone. In other words, Medicare steps in to bring the Advantage plan back in line only after real harm to real people has already occurred. This is why it's important to say this clearly. Medicare Advantage and Medicare Supplement plans are not equals. If someone wants to compare equals, the correct comparison is original Medicare Part A and B versus a Medicare Advantage plan. The Advantage plan is designed to have the benefits roughly equivalent to original Medicare with no supplement. A Medicare supplement is not an alternative to Medicare, it's an enhancement to Medicare. Once you understand that, the decision becomes far more logical and less confusing. One final point. Medicare supplement plans are guaranteed renewable, and that means the benefits never change. And you can keep your plan as long as you continue paying the premium. Medicare Advantage plans are not guaranteed renewable annual plans. That means any feature of the plan can change every year. Networks, co-pays, deductibles, extra benefits, and even the maximum out-of-pocket amount. Now, as you plan for retirement, keep these two facts in mind. Medicare supplement plans adjust for rising healthcare costs by increasing their monthly premium. The benefits are fixed, so if healthcare becomes more expensive, the price of the plan rises. Now, Medicare Advantage plans, on the other hand, do not have fixed benefits. Their low monthly premium is their primary attraction. As healthcare costs rise, the plan adjusts by lowering benefits and or increasing cost sharing and raising the maximum out-of-pocket or adding deductibles. So in short, the supplement increases costs, the Advantage plan decreases benefits. That's an important distinction to consider as you plan your retirement. Now, if this explanation has helped clarify how these options really work, please consider liking the video and subscribing to my channel. And when you do this, and you're interacting with YouTube, and it helps YouTube say that this video is good for people just like you. So it helps others find this information. And if you want Medicare explained carefully, accurately, and without shortcuts, please subscribe to this channel. I'm Matthew Claassen with Medigap Seminars, and I'll see you in the next video.